North Richmond Community Health is many things to many people. I think it's quite unique in that it is one of the very few community health centres that is place-based. So we're sitting on the estate with the community that we are most focused on. The housing estate is home to around 3,000 community members, tenants, and 75% of those are from culturally and linguistically diverse backgrounds.
Our focus has always been on our immediate communities, diverse communities. The values of community health, they are really access, and access for vulnerable communities. It's not profit-driven. They talk about, in general practice, all the GP trainings about patient-focused care. Well, in community health centres, it's about community-focused care.
I first came to the centre in 1975. Whitlam was still in power and there were lots of health initiatives that Labor government had started, so it was a really interesting time. The first centre was a small building, let's say. It fitted probably into the reception area of the current building. So it was pretty busy, pretty noisy, but there was a real community feeling about it. And the residents of the flats and the local surrounding area were involved.
The centre management, the board, there were community boards at that time with community people from the diverse backgrounds, and that was encouraged. And board meetings were held with interpreters interpreting, for people whose English was not good enough. But that was a barrier to overcome in order to have the inclusiveness. And that was also reflected in the staffing. The other big thing in the 80s certainly was the community development approach and having the so-called ethnic workers. There was a Turkish ethnic worker and they were doing group work, they were doing health education. There was a Hispano-American Spanish-speaking worker as well. And the community development approach also worked on bringing community groups together, so under their own steam. So there was a Vietnamese women's group, and then there was an East Timorese middle and age group, and all these community groups were supported by the health centre. And so that was the great bridge that linked healthcare and made it accessible and welcoming.
One of the groups I worked with was some middle-aged women. The issue that they felt they really wanted to communicate was to keep the parent visas happening. And so we made this poster. The image on it is an Egyptian woman and a Vietnamese woman embracing each other in amongst a laurel of native plants and animals. Coming out of an envelope, it says, "Dear Minister, would you be kind enough to let our families join us in this beautiful country?" And that was printed on, I think it was probably 5,000 postcards. And we ran a postcard campaign and sent it to the Minister, Robert Ray, I think it was at the time. These projects often humanise the people who are asking for something. It was an important message from them.
We have so many clever people that work at this service, and so to harness the expertise of different programs, clinicians, clinical focus areas is just a joy, and to have it sort of all quite readily available, you can start to go, right, can our dietitian start working with the community to provide some education sessions in line with the exercise classes that we're running? And we probably take it for granted to some extent, but we are offering, gold class services. Our Children's Allied Health program is remarkably well regarded.
My role at North Richmond has been to be a pro bono orthodontist. I do think it's been very fortunate for the people who live in the social housing nearby here that they have this facility, because I'd be surprised if many of them availed themselves of dental treatment if it wasn't for the proximity and the availability of it. We've had the pleasure of providing them with terrific treatment and giving them life-changing experiences. One of the thrills is occasionally I'm walking locally down the street and I'll have either the parent or one of the children we've treated, and they'll come up to me in the street and say how pleased they are with the outcome that they've achieved.
North Richmond Community Health has funded drug and alcohol services here for many years. We had, even in the old building, we had a needle syringe exchange program, which was massive. We also had a large drug and alcohol counselling service, which worked well with an outreach service to try to keep people safe. So if they're going to be using, to make sure that they're using with clean needles and in a supervised way, which then turned into the medically supervised injecting room.
I suppose what we've seen is, pleasingly, a shift of how we support those communities to inject drugs safely. And we're really proud that the injecting facility now supports some days in excess of 300 visits per day through the centre, so you can sort of appreciate the complexity of supporting those visits safely and meaningfully. We're really proud of how far we've come. Certainly we still get some pockets of community or government that might disagree with the facility, but all in all, I can definitely objectively comment to say that the difference it's made is nothing short of remarkable for community.
We were all in shock during COVID. You know, the whole community was. The healthcare sector certainly was. Here was a new virus with people with no immunity. We did not know the consequences of it, and people were quite terror-stricken.
The initial days were really, really dark for community. There was a lot of fear off the back of the Flemington lockdowns. So we were asked to stand up a response on a weekend, a few days after those lockdowns commenced. And so set up a huge testing program initially, and the team that were involved in that were able to test the whole estate. So we had a baseline to understand how many cases we were dealing with. And so we very quickly commenced a model where we employed directly. And so then as that program grew and evolved into the high-risk accommodation response program, I think there was a time where we had about 15 different languages in the team. Through that trust, we were able to achieve, quite remarkably, 100% double vaccination. I think what it highlighted was just how beneficial place-based primary healthcare is. I think this demonstrates sort of just how critical some of the smaller services are and will continue to be. North Richmond has so much capability and potential. It is a small community health service, so my hope is that it can maintain its place here for the communities that it serves in Richmond. I hope that it's here for another 50 years, and I don't see why it can't be.
We've got to keep that momentum going and make sure that we continue to thrive, and that there's another 50 years where at the end of that people can talk with pride about working in a North Richmond Community Health Centre.